A first or second?
First.
Good job. The first, it has this smiley face in the central groove because of this extra distal cusp. 3 cusps on the buckle. We know the mesial is typically the larger. 2 cusps on the lingual. Which one has the 3rd distal cusp? The mandibular first permanent molar.
3rd distal is
From the buccal aspect. So the tooth is rotated. This is looking at, this would be my buccal. And we have that 3rd distal cusp. The larger cuspal cusp is mesial, typically. So which tooth would that be?
That would be.
That's the distal. That would be
It's 30.
30, good. And the maxillary molar is going to have the trifurcation. What is this part called between the CEJ
root trunk.
and the roof of the furca?
Root trunk.
The trunk, good.
Yes, that was on the.
Yeah, it was.
And you may see that again.
Chill.
It's important for us to remember this is a mandibular first molar. And the depth of that root trunk between the CEJ and the furca, if I have a couple millimeters of bone loss here, all of a sudden, now I have bacteria that says, oh, look at this wonderful tunnel we found underneath.
Nice, wonderful carriage.
And periodontal loss, they're much more subject to periodontal loss with lesser degree of involvement because a small amount of bone loss, the shorter the root trunk, the quicker the furca is exposed. Once you create another niche for bacteria that love it in a warm, dark place, they're anaerobic, they don't need oxygen to survive. The deeper they can go, the more hiding places that they can find,
So
and the
that
more
where your
destructive.
antimicrobial rinses will come into play?
Pack some arrestin in there and scale it well, pack some arrestin
So
and
it's a more serious case if the person has,
trifurcation,
no,
sorry.
bone loss in the mandible.
In the first molar, the root trunk is shorter, so it would be more susceptible, and that is a question I've seen on boards. But it's the relationship with 3 millimeters of horizontal bone loss, which means it's equivalent between the tooth, which tooth would be at greater risk, the first or second? And it would be the first because the root trunk between CEJ and the furca is shorter, which means the same amount of bone loss is going to expose that furcation sooner.
And that's the same for the maxillary?
And, yes, on the maxilla, it's even more complicated because remember, we have not only the furcation on this buccal aspect between the mesial buccal and distal buccal root, but we also have the furcation in the proximal between the mesial buccal root and the lingual and in the distal. So we have a situation where the tooth, actually, I have a present for you. We have a situation where a tooth looks like this, so I can probe here, here, and here. I'll grab your quizzes and I have something fun for you to pass around. Dr. Browning just found them in the closet and I was so excited. I said, oh, we needed these a couple weeks ago. So maxillary teeth, how do we tell the first molar from the second? What is the maxillary first molar found at the second? The cusp of Carabelli. Which cusp do we find it on?
First.
Which cusp do we find it on?
The lingual. Paddle.
Mesiolingual. That is my cusp of Carabelli. Looking at the occlusal view, my mesial cusps are larger. The buccal are normally larger, so I orient this as my mesial side, the bigger cusp, that's the largest, that's the buccal. the largest is mesial. Would be my lingual side, and here's a cusp, and what do I have hanging out? Looking at the proximal view, this is my cusp of Carabelli. And that is on a maxillary first, permanent, and a maxillary second primary. But this furcation, we were just talking about the furcation. So from the buccal, you have a furca between these roots to the lingual root, but from the proximal view, you also have a furcation on both the mesial and distal between those roots. So if you see cusp of Carabelli, you know it is a first molar. Also, the first molar has a much more rectangular shape to it, where the second has this rhomboid or squished, like a rectangle that got sat on. Much more squished appearance.
And I noticed the furcations get wider, I'm sorry, as you get away from the back of the mandible.
The first has more divergence between the roots than the second. And it's a little bit hard to see on this picture, but they're more closed together. So we're good between firsts and seconds?
Mm-hmm.
And I promise not to put thirds on the exam.
We can't recognize them.
They're pretty,
They can
pretty,
be very,
weird.
they don't really have a particular pattern of
Yeah.
development, even though the book talks about a few characteristics, but in my
I compared
experience-
them to a bunch of panographs and I gave up. I was like, nope.
And I've seen a
They're all
couple,
different.
well, I was gonna say a couple thousand mouths, but probably more than that. We had an active patient base of 2,400 in the last office, so.
Good.
They're just not predictable. So this wider divergent of the root is also on a first. On a second, the roots are closer, more compact, more closer together.
It kind of reminds me of a flower that gets close, like tighter and tighter as you go back.
Mhm.
And the third one is the smallest one.
And the third typically are very conical, which makes them come out easier. Very compact, condensed.
And their curvature, can the side be told, like, can you really tell the side by the curvature if it wasn't on a card? If you were just looking at an x-ray of 1/3 molar, could you really tell what side?
To determine whether it was right or left,
Mm-hmm.
yes. And usually it is with that distal inclination, that
Okay.
curve of speed that we talked about,
Yeah.
the curve of Wilson. Remind me to check those slides. It's curve of speed, curve of Wilson. So you're using that for orientation, plus the films themselves have on film-based a dot, so you know inside, outside. On the Scanx, the digital plates that we use on the floor, there's a little letter A. So you have to orient it can be upside down, but it has to be an A, because they can mirror image themselves, so if it looks like a G, then it's backwards, because even if I turn that this way, that's still inside out.
Makes sense.
I had a student on the floor the other day, a senior student who was 2 weeks away from graduation and who had a set of FMX up on her view box, or not a view box, but hanging in her module, which is required when you're scaling your teeth. And crown that looked on the x-rays like it was on number 15, and the 3-unit bridge, which looked like it was from 19 to 21, was actually teeth numbers 29 to, or 28 to 30, and the giant rampant caries that she told me she wasn't going to scale the tooth because it had cavity was number 2, not number 15.